A 37-year-old woman presents with 2 days of fever. She is very unwell and now has bleeding from multiple sides. Blood tests show elevated fibrin degradation products +++, platelets of 30, bleeding time is prolonged, PT is prolonged, APTT is prolonged. What is the most likely diagnosis? So this is a very sick person who is bleeding from multiple sides as a result of disseminated intravascular coagulation. Hemophilia will just happen in boys with classically prolonged APTT and deep bleeding into muscles or joints. ITP will have low platelets but will not have any of the other changes. Factor V Leiden is a congenital condition which predisposes individuals to thrombosis, and sepsis could be confused, and in fact sepsis can lead to the DIC picture. A 7-year-old girl presents with purpuric rash on her buttocks and legs, abdominal pain, arthritis, proteinuria and haematuria. What is the most probable diagnosis? The answer here would be HSP, Henoch-Schonlein Purpura. Classical age, classical presentation, multisystem condition because of vasculitis. It is not thrombotic thrombopenic purpura because that is secondary to illnesses that can lead to widespread thrombosis causing thrombocytopenia. It is not ITP because we do not know the platelet count, although when patient presents with HSP, you will always check full blood count to be certain it is not ITP. It is not Hemolytic Uremic Syndrome, in which there is classically bacterial dysentery with bloody diarrhea, with particularly E. coli 0157 strain, and this is certainly not measles because of presence of proteinuria and haematuria. A 62-year-old man presents with 3-month history of weight loss, tiredness, fever and abdominal discomfort. Examination reveals a palpable spleen felt up to the umbilicus. Initial tests show significantly increased WBCs of 127, hemoglobin of 8.7 and platelets of 138. What is the most likely diagnosis? This patient has CML. Now he has a huge spleen together with symptoms of weight loss, tiredness and fever, suggesting a myeloproliferative condition. Very high white cell counts, normal being 11 to 18. Now in this age group you would think of CML as the most common myeloproliferative hematological carcinoma. Many of them would have Philadelphia chromosome positive, and absence of Philadelphia chromosome would lead to a worse prognosis in such patients. A 15-year-old girl had an acute onset of fever, sweating, bruising and petechiae. Full blood count shows hemoglobin of 6.3, white cell count of 1.1, neutrophils of 0.1 and platelets of 14. No abnormal white cells were seen on the blood film. She was transfused and given IV antibiotics and her condition improved. 3 weeks later, her blood count has returned to the same picture. What is the most likely diagnosis? This patient would have a aplastic anemia. White cell counts are very low and there are no blast cells, so it cannot be ALL. AML and CML are diseases in adults. Pernicious anemia would lead to vitamin B12 deficiency and megaloblastic anemia. So there are 3 cell lines suppressed. There is pancytopenia, which is the cause of aplastic anemia. 73-year-old woman has lymphadenopathy and splenomegaly. She feels well but is getting recurrent chest infections. Which picture you might find on a blood film? At this age of 73 years, it is likely that she will have excess of mature lymphocytes with the diagnosis of chronic lymphoid leukemia. The clue is the lymphadenopathy and splenomegaly. In myeloid leukemias, acute or chronic, you get granulocytes or blast cells. In acute lymphoid leukemia, which is common in childhood, you get abnormal immature lymphocytes, but you get mature lymphocytes in chronic lymphoid leukemia, which will be expected in this age. Yes, it is always good to refresh the topics that you found tricky. Spend a few minutes reading around those topics that you know less about. Finally, guys, leave a comment or press a like button to encourage us to upload more videos like these.